Using point-of-care ultrasound to investigate adults who are suspected of having kidney stones is something that a lot of our colleagues who do their practice in mostly adult emergency environments are very familiar with. We are, however, seeing an increasing number of stone-forming children, mostly late teens, especially in some geographic regions considered to be stone belts. As we encounter this more and more in pediatrics, I thought it would be interesting to talk a bit about some of the secondary findings of unilateral renal obstruction, because most of us by now are familiar with the appearance of hydronephrosis. So one of the other things that you can use when investigating the presence or absence of stone is it's always great if you can directly visualize the stone itself, but we know that that is something that you see in the minority of cases of urolithiasis. And a trick that you can use to help tease out those ones that you can't directly visualize is known as the twinkling artifact. So this involves putting a color Doppler gate on, or even possibly a power Doppler gate on your screen around where you think the ureters are running, and slowly scanning while looking for the sudden appearance of a comet tail of Doppler signal. So this will be usually a triangular or inverted pyramid shaped area of artifact, and we talk about it being artifact because it will look like Doppler signal going in all directions at once. You'll have red, blue, and a large amount of yellow. And this is indirect evidence of a stone, with the physicists in the ultrasound community hypothesizing that it's either a collection of air bubbles micro air bubbles on the surface of the stone, or just ping-ponging of the signal within the lattice of the stone that generates this artifactual noise that looks like Doppler signal going in multiple directions. So that's a nice little ancillary technique you can add to your investigation for stones, and can anticipate that you might be doing it more as we see the burden of urolithiasis beginning to shift into the pediatric population.